about 20 years ago, MRIs were studied, and they did 100 MRIs on people off the street, never had a back problem. 35% of them have something so significant you could justify surgery, but there was nothing wrong with them. And that's the issue here. It's honesty and integrity in the medical profession, and you have to move it aside from money and the business that's running and employing the doctor.
Well, what I try to communicate to the patients is then, do you really need the MRI? And then I try to explain to them when an MRI is really indicated. So because I also feel it's not only the institution, but also certain patients, they want it very much, especially if they don't care much about the money.
They are assuming that the MRI is going to be the definitive test to prove what's wrong with them or not. And it's not the definitive test. It's raised up to a high bar, and it's not. It's a double-edged sword.
Let's say they come to me with some mild to moderate symptoms, and I see no serious indication like neurological problems, then why should I encourage them to take the MRI? No? It's medically not necessary, and it doesn't give me any great benefit. No? Also as a physical therapist.
An MRI, if you have a neurological problem and someone has a drop foot or can't walk on their toes or their heels or something, and they have a specific neurological problem, then I think an MRI is necessary.
Yeah.
But without those clear-cut signs and symptoms, just because you have back pain and a little leg pain and the medical examination does not confirm anything, I agree with you. You don't need an MRI. An MRI would be done maybe the second or third visit should we do conservative treatment, medications, physical therapy.
Yeah.
And after the second or third visit, within 3 to 6 weeks, it doesn't get any better, then we need to expect.
Or even longer at times. No?
It can, right. But if they're out of work,
yeah,
and they have to supply food for their family, you have to balance those
needs
needs
of
also.
course. Yes, sure.
That's all it is.